Today I have with me Dr. Jayadattpawar from Sakra Premium Clinic. And welcome, doctor. Welcome to the live show. And he is there with us to discuss an interesting topic where everybody is looking at today: how to lose weight without a surgery.
Yes.
Doctor, can you please let me know what is the most effective non-surgical methods for weight loss?
Yes.
And how do they compare in terms of safety and long-term results?
Yes. Thanks, Jayadattpawar, for having me, first of all. So basically, weight loss without surgery is a hot topic right now.
Yes,
so
sir.
everybody is interested in it. So there are quite a good amount of effective surgical, non-surgical methods. Among that is the behavioral therapy. Then we have some balloon therapies. Then we have endoscopic therapies. We have even some pharmacotherapy, that is drugs and injections to lose weight.
Okay.
Yes. So among that, the most effective method is always individualized. It differs from patients to patient. We have to tailor it according to patients.
Okay.
However, I can just list you out some of the methods. That
Okay.
is most important behavioral therapy to try to motivate the patient, make sure he understands how weight loss would help him,
Okay.
and then decide whatever diet is important for him, make some lifestyle changes.
Okay.
And these are the basic ones which we can do, followed by our medical therapies, which are endoscopic and non-endoscopic methods. And the most frequently used and the famous one right now is the balloon therapy, which I use.
Okay.
Yes. In terms of safety, to be very honest, the bariatric is very safe. All the balloon therapies and other non-balloon therapies are very safe, and they have. But these are all short-term goals. Bariatric surgery is the only one which can help you in long-term obesity.
Okay. Doctor, can you please tell me the role of diet and nutrition in achieving sustainable weight loss without
Yes.
surgery?
Yes. So, initial strategy for anyone who wants to lose weight, the diet would be a low-calorie diet.
Okay.
That is, start with about deficiency of 500 calories. That is, normally you're supposed to take up to 2000, anyone about 70 kgs.
Okay.
You have to take now up to 1000 to 1500, reduce that 500. And then the diet and nutrition is a hot debate, that is whether to individualize accordingly or make a generalized diet chart for everyone.
Okay.
The thing is, initially there was a strategy that you give them low carbohydrate diet and continue with the same thing, but now it's like you have to give low fat diet along with that low carbohydrate diet. That is the trend now with high protein diet. This is the very commonly used terminology, and this is how we are prescribing to the patients as well.
Okay.
And this has to be consistent throughout a period of time, maybe about 6 to 12 months. Then only you can achieve a sustainable weight loss without surgery.
Okay. Doctor, what are some evidence-based lifestyle changes that an individual can make to support to lose their weight journey?
See, the whole point of the pediatric program, even in our hospital in Sakra, is a holistic approach. So it is evidence and science based. That is, you have certain goals, you have to create certain goals, keep a journal, that is, you record what you're eating, when you're eating, what is the timing, then set some realistic goals. When I mean realistic goals, that is, you just cannot say that tomorrow onwards I will exercise. No. Okay. You have to be specific, 15 minutes, 3 rounds in this week.
Okay.
And there has to be a third person, reach out to a partner, reach out to a family member, have support so that he's monitoring you as a third person. Okay. And you're not biased.
Okay.
That is one lifestyle change. Then the diet. Diet is simple. Don't have binge, should stop binge eating, stop eating after 11 o'clock, 10 o'clock, and always follow the physiological clock, that is eating in the day and fasting. Probably you can reduce the amount of food in the night, especially after 7 o'clock, 8 o'clock,
Okay.
or try avoid having food, and also avoid having high salted food and high sugary foods.
Okay.
These are evidence-based lifestyle changes you can do. One is get good sleep, and of course you have to stop smoking and drinking. That's the best thing for anyone.
Okay.
In case you cannot stop it, reducing is the best way to do.
Okay. Okay, doctor. And how important is physical activity in non-surgical weight loss plan, and what are the types of exercise recommended for optional results?
Yes. So physical activity is very important. As we say, eat less and move more. So as much as possible, try to take elevators at workplace. Try to avoiding elevators.
Okay.
And try to walk as much as possible. One thing. There are 2 types of physical exercise what we prescribe. That is, one is a normal moderate intensity, and one more is a vigorous one. The moderate one is just walking. We recommend about 5 hours per week. If you can walk 5 hours per week, it's a good thing for about 20 to 30 minutes.
Okay.
Then vigorous one includes the aerobics, the high sports like football, be basketball, swimming, jogging.
Okay.
These are all vigorous sports. It should be that good that you can feel that your pulse is high, you are not able to catch a breath. That is vigorous. So if you are able to do that, then it's good, well and good. Otherwise, these moderate intensity will also work. But this has to be with achieving a goal. That is 5 hours per week has to be there.
Okay.
That will only change your lifestyle, and also it will help you in the beginning of your weight loss journey.
Okay, doctor. Doctor, are there any specific medical conditions or factors that may hinder weight loss efforts without surgery, and how they can be addressed?
Yes. So the most important factor which is affecting your weight loss journey is non-adherence to the diet and consistency, lack of consistency. So today this week you are completely starving, which doesn't help actually, and the next week you are eating, or from morning you are starving and suddenly at night you can't control the hunger pang and you start eating. So that is the lack of consistency and lack of adhering to diet is the most important factor. That is psychological. But when it comes to medically, there are few conditions and there are few drugs which you're taking, which is actually causing you weight gain.
Okay.
For example, somebody who's having depression, somebody who's taking antipsychotic drugs, they tend to have weight gain.
Okay.
And you can always consult your psychiatrist, psychologist to have an alternative drug. And there are some bodybuilders who are taking steroids, unauthorized steroids, that also causes weight gain.
Okay.
And then you should know about certain diseases like hypothyroidism, thyroid issues. Then there are Cushing syndrome. Then there is PCOD, which is very common in women, that causes weight gain.
Okay.
So all these have to be treated individually by individual set of doctors, so that even if you start your weight loss journey, it helps you in losing weight faster and better in a scientific way.
Okay. Okay, doctor. What are the potential benefits and drawbacks of using medication or supplements to aid in weight loss?
So in India, basically, there are very few drugs for weight loss, one thing. And second thing, the weight loss journey comes with fighting diabetes as well.
Okay.
So these drugs, most of them are injectable drugs, so they are not oral drugs. So that is one thing. Second thing, the good thing about them is they are for short term, 6 months to 1 year. This causes about 5 to 8% of total weight loss. Then third thing is the side effects are quite less. One thing, there are newer drugs. Then the drawbacks you can say is that one is very expensive, and it's causing only 5 to 8% loss. That is not much over a period of 6 months to 1 year. However, there are 1 or 2 drugs which are withdrawn from the market because they had some issues that they might cause cancer. There is a possibility that they might end up causing cancer, so they are withdrawn. And also there is a huge market of off-label drugs. That is, unauthorized people are taking some diabetic drugs to lose weight. They're losing weight, but at the same time, there are severe side effects.
Okay.
So those are also unauthorized and not monitored. Somebody else is prescribing, not the pediatric physicians.
Okay.
So these are all the drawbacks of the drugs. Otherwise, it's a short-term, for short-term goals for 3 to 4 months, and who's not expecting more weight loss than 5%, only it's good for them. Otherwise, surgery is the next option.
Okay. Doctor, can you discuss the role of behavioral therapy and counseling in helping individuals to overcome barriers without surgery?
Yes. So behavioral therapy is very important, and intense behavioral therapy will make the patient change his environment, which is actually causing the stress, which in turn is making him eat more and cause weight gain, one thing. Second thing is that if somebody is having an underlying chronic depression, and that also can be treated by behavioral therapy.
Okay.
And then a person can have certain goals and physical activity, which can be increased with the help of this. Okay. So behavioral therapy is an adjunct to the weight loss therapy, that is along with drugs or along with surgery or along with the endoscopic balloon therapies. This is an adjunct. Behavioral therapy becomes a side, an effect, so that the increase in weight loss is more. That is the whole point of it. Behavioral therapy will not guarantee you weight loss, but it definitely helps you better with the weight loss.
Okay. How does stress management and mental health support contribute in weight loss?
So currently the modern society is extremely stressed,
Okay.
and because of this, the stress levels, the whole diet has changed into Western style diet. That is, they're taking high intake of salt, there's high sugary foods, high fatty foods. They end up having binge eating, watching TV or watching Netflix and all those things. So that is the whole point of stress management and mental health. One thing is that we get you in touch with a therapist who sees you almost weekly, twice initially for the first 3 months. then he sees you every month.
Okay.
That is one thing is for this. Then along with that, there is teaching of diaphragmatic exercises, that is breathing in and breathing out. And there are some visualization exercises which will help you to achieve a certain amount of goal in particular duration of time, so that you are motivated to lose the weight, and also your stress is managed carefully along with that. So there are various exercises along with yoga, meditation, which can be put up in the plan so that you go accordingly, and also there is the other medical management of weight loss is also going along with it. So the stress management is directly proportional to the weight gain. So once that is managed, even the weight down also comes. Okay. And because of this stress, there is a lot of cortisol released in body, and steroids get released. So again, you are gaining some weight, or the water retention is there. So you will feel that I'm gaining weight. So all this is managed once. So there is naturally the weight loss journey gets enhanced.
Okay, doctor. Are there any novel or emerging surgical techniques or therapies for weight loss?
Yes.
That show promise in medical field?
Yes, definitely. The thing is, what we are doing at Sakra is we are doing bariatric surgeries. One. Second thing, there is a whole holistic program with nutritionists, endocrinologists, the diabetologist, the psychiatrist, the psychologist, so that the person has a overall this thing for weight loss. The motivation is also there, and also you are treated equally by all the doctors.
Okay.
So the recent therapy is one is the swallowable balloon, which we are using. So it's just a 10 minutes procedure. A patient swallows the small capsule, which goes inside the stomach and stays there. And we take an X-ray to confirm it. So within 2 hours, you are discharged back home. And then this works. How does it work? Is that it fills up your stomach. So one is you feel less hungry, and also it fills up fast. So you eat something, a small amount of food, it fills you up. So with this, you get a good sustainable weight loss within 4 to 5 months. About 15 to 20% weight loss is there. And if you want to lose more, another balloon can be placed. That is after the next 4 to 5 months. So the best thing is about this is there is no endoscopy required, there is no anesthesia required, there is no surgery required. Of course, this is useful till a certain BMI only, probably say up to 30 BMI. But it's definitely a day-to-day procedure, which is a novel and most emerging technique right now, which can be used in obesity and diabetes patients.
Okay, doctor. What advice would you give to someone considering non-surgical weight loss options, and how they can maintain their progress over long term?
Yes. So what I would suggest is at Sakra, what we are doing is have a overall multi-component therapy that is involving the dietitians, doctors, surgeons, bariatric surgeons, psychologists, even a caretaker, and also a nutritionist who is in constant touch with you, so that you have they begin with a non-surgical option or to lose weight. That is for the first 3 months. We change their diet, lifestyle changes with behavioral therapy, and then we wait for them to try to lose weight on their own. Only when it doesn't work, we go for drugs or surgery or a balloon procedure. So based on this, we can say that there will be a good amount of sustainable weight loss for a long term. Since the follow-up is continuously with nutrition and dietitian, it's not like after surgery you are let go on your own. Since patients are in constant touch with the bariatric surgeons like us, there will be a sustainable weight loss. And we are always with them till their weight loss journey and obesity journey is completed.
Okay, doctor. Thank you so much for giving us insights on this, where many people are looking out to lose their weight. And thank you viewers for joining us. And to book your in-person appointment with our Dr. Jayadattpawar, you can log into our www.sakrapremiumclinic.com, or you can download our Play Store app from our Play Store, Sakra Patient app, and you can book an in-person appointment with the doctor. Thank you, doctor.
Thank you so much.